You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.
Welcome to Leyla Weighs In here on the Intelligent Medicine podcast. This is Leyla Muedin, your host. I'm a registered dietitian nutritionist here in New York City. And if you'd like to reach out to me with a question that you'd like me to answer or weigh in on this podcast or a topic of interest in health, nutrition, wellness, you can reach out to me at questions@drhoffman.net. That's questions@drhoffman.net. I want to talk to you about bone health. I want to talk to you about the things that impact osteoporosis. For example, it could be that your most recent bone mineral density test is showing you have osteopenia, osteoporosis. Osteopenia is not really a medical diagnosis, but many people are concerned because progression may be to osteoporosis. Whether bone mineral density testing is actually measuring the strength of bone is a separate topic, and one that may become controversial or is controversial now, as scientists are looking at other methods that may be a more precise measurement of bone health and bone strength. So, what are the things that there could be several reasons that bone mineral density is not improving? First, you got to make sure that you've got enough vitamin D in your body. It's not just a matter of how much are you taking, but how much are you absorbing? And the thing to do is to get a vitamin D level checked. That test is 25-hydroxy D, 25 in parentheses OH for hydroxy, D. That's the proper blood test for measuring vitamin D levels. And the optimal range is anywhere up and over 55 to about 85. We don't want it that much over 100, so that's why throughout the year your vitamin D dosages can vary. They can change based on your serum levels, on your blood test levels. So it's important. You can't just take a stagnant dose all year long, day in, day out of the same vitamin D. You don't want to go up and over 100. That may adversely impact down the road kidney and liver function. You don't want that. So you want Goldilocks. You want the right amount of vitamin D in your system. Typically, that's between 55 to 85 nanogram per ml. So another thing that's critical to the proper metabolism of calcium is vitamin K. You've heard me speak a lot about vitamin K recently, and vitamin K is also what's responsible for keeping calcium in the bones, keeping calcium away from where it shouldn't be, like in your soft tissue or in your arteries showing up as calcification, right? Vitamin K is helpful in directing calcium back to the bones. Vitamin D is also kind of a bus directing calcium back to the bones, but all of these nutrients, all of these vitamins, they work synergistically. The vitamin minerals, they work synergistically. Now, another thing is maybe you're taking vitamin D, maybe you're taking calcium, maybe you're taking magnesium, but you're not digesting and absorbing properly. So you have to think, do you have any GI issues? Do you have frequent diarrhea? Do you have inflammatory bowel disease, like Crohn's disease or ulcerative colitis, or maybe celiac disease? And have you ever been checked for food allergies or intolerances? This is very important because if you continue to eat the foods you're allergic to or intolerant to, this is creating inflammation in the body and as well as in your GI tract, which may inhibit the absorption of these critical micronutrients, your vitamins and minerals. And these issues, they need to be addressed to prevent any nutrient deficiencies. Another thing to think about if you're concerned about your bone health is, do you have GERD, gastroesophageal reflux disease, GERD? Do you have heartburn? Are you taking something for that? Maybe you're taking Pepcid. Maybe you're taking a proton pump inhibitor like Prilosec or Nexium. These proton pump inhibitors, these PPIs, inhibit the absorption of minerals like calcium and magnesium. And we do know for a fact that long-term use of these PPIs is a risk factor for osteoporosis. If you've been taking omeprazole, Asifex, Protonix, all of these, if you've been taking these for years and years, and you're wondering why you're a 49-year-old with osteoporosis, yeah, that's a reason for that. Because we need our stomach acid to digest and absorb these critical nutrients. So you want to keep that in mind. Also, are you vegetarian? Are you vegan? Are you on a heavily grain-based diet? These foods are acidic. Mother Nature knew what she was doing. She gave us acid-forming foods and alkalinizing foods. The acid-forming foods being flesh, being animal protein, and the alkalinizing foods being produce, vegetables, fruits. So too many acid-forming foods in the diet can excrete calcium from the bones. Choosing alkalinizing foods like produce instead of grains, choosing vegetables instead of grains, instead of rice and bread, even gluten-free grains or gluten grains, it doesn't really matter. The grains are very acidic. So, and also, being on a vegetarian or vegan diet is actually a risk factor for fractures, bone fractures, because healthy bone turnover requires sufficient amounts of high biological value protein. This would include low mercury and wild fish. Low mercury, this is important because if there are, with all the heavy metals in the environment, be it mercury, lead, arsenic, any of those, they don't hang out in our circulation. And we're not necessarily excreting them properly if we're not detoxing well. But these heavy metals, they take up residence in our bones and in our organs. And that displaces healthy osteocytes, healthy bone cells, which make up the matrix of the hydroxyapatite, which is the formation of the calcium in the bone and all those other critical components for bone, for healthy bone. So, including low mercury in wild fish, free-range poultry, because you don't want commercial poultry. The pesticides or other herbicides in the feed of commercial chickens and all that, they contain arsenic. You don't want that. So you want free-range and organic. You want organic eggs. You want grass-fed meats to help increase bone mineral density. Another useful check when it comes to blood tests, besides vitamin D levels, even magnesium levels, right? You want to check serum DHEA sulfate. And the proper blood test is called DHEA sulfate, Sulfate. DHEA sulfate is the proper blood test. And having a DHEA in the upper range of normal helps with bone mineral density and bone health. So, and listen, even if you already have full-blown osteoporosis and you're having to take the bisphosphonate medications like Fosamax, Actonel, Boniva, the importance of nutrition therapy cannot be overstated. So really a thorough assessment of risk factors like nutritional deficiencies is the first way to go. Vitamin D, magnesium, DHEA, right? The use of prescription and over-the-counter medications, and the determination of high biological value protein, which is animal protein. This is essential. Also, weight status, metabolic abnormalities, right? And older individuals need twice as much protein to mitigate the incidence of sarcopenia and, by association, osteopenia and osteoporosis. Because healthy muscle and bone turnover and retention of that healthy muscle and bone, the retention requires it. Now, unfortunately, as people get older, there are decreases in appetite. That often occurs with advancing age, and making low protein intake is a primary risk factor for poor muscle and bone health. This can lead to falls because when you're not strong, when you're losing muscle, you're becoming frail. That can lead to feeling unbalanced and leads to falls. And of course, subsequent bone fracture. Becomes a downward cycle of good health. Weight training and balance exercises help to keep us strong and to keep fragility at bay. So such exercise should be a part of your daily life. Incorporating resistance exercises in particular and optimally, not just twice a week, but 3 times a week is what the research has shown us. Doing weight training exercises 3 times a week for optimal lean body mass retention. So you see, this is not as simple as taking more calcium, because when you get your basic metabolic panel from your doctor, nobody has low calcium. Almost nobody, right? And it's not about calcium, and we don't make, as a nutritionist, Jackie Storm used to say, or still says, you don't make the house stronger by adding more shingles to it, right? And this is not as simple as taking more calcium. So appropriate medical nutrition therapy, helping to replete any nutritional deficiencies based on your individual biochemistries, and to address any metabolic challenges, and to provide an exercise prescription. This is all very important when it comes to bone health. Another thing is, and this is lately in the research and something I'm going to write about in an upcoming newsletter, because we need to be rethinking fragility fractures in the setting of metabolic abnormalities like hyperinsulinemia. This is very interesting because patients with type 2 diabetes and or cardiovascular disease, both which are conditions of hyperinsulinemia, they have lower levels of osteocalcin and bone remodeling. We need osteocalcin for bone remodeling, just like we need the required vitamin D and calcium and magnesium and vitamin K to support osteocalcin. or osteocalcin, it's not just a matter of taking those nutrients. It's about, are you in a metabolically abnormal state like hyperinsulinemia, type 2 diabetes, cardiovascular disease, because they have lower levels of osteocalcin and bone remodeling and increased rates of fragility fractures. Now, the next thing I'm going to say is very important. Unlike osteoporosis, which is low bone mineral density, type 2 diabetes, bone fragility, hyperinsulinemia, osteofragilitis, this is a phenotype that presents with normal to or even increased bone mineral density, which really begs the question, if you can have bone fragility in the setting of these metabolic abnormalities having to do with hyperinsulinemia, which are actually showing a normal bone mineral density or a positive bone mineral density, what's bone mineral density actually measuring here? Even if you have a good bone mineral density, if you have a metabolic abnormality like hyperinsulinemia, type 2 diabetes, it sets you up, it's a risk factor actually for fragility fractures. Hyperinsulinemia and insulin resistance positively associate with increased bone mineral density and fragility fractures. And because this has come to light, I'm sure this is one of the many reasons that it's so important to really revisit bone mineral density as a useful measurement of bone strength, because in my opinion, it looks like it's not. So, hyperinsulinemia actually decreases antioxidant activity in the body. Now, of course, if it decreases antioxidant activity, it's not quenching free radicals. So this is actually increasing the reactive oxygen species, right? And poorer mitochondrial function. And when we don't have proper mitochondrial function, because you can't have hyperinsulinemia, a metabolic abnormality, and have good energy for mitochondria. You don't have good functioning mitochondria in the setting of hyperinsulinemia and type 2 diabetes. You don't. And you need well-functioning, high-energy production capacity mitochondria for osteoblast cytogenesis, for bone cells. You need properly functioning mitochondria for bone cell creation and turnover. These are called osteocytes. Bone cells are osteocytes. Osteocytes directly mineralize and resorb bone and inhibit mineralization of other things via pyrophosphate. Hyperinsulinemia decreases vitamin D availability because vitamin D gets sequestered by fat cells. So if you've got overweight, hyperinsulinemia, diabetes, that vitamin D is being sequestered even though you're taking some, which can also lead to vitamin D deficiency, as we know. So all of that, decreased bone remodeling is what ensues. And that way, even your critical minerals and vitamins aren't being used the way they're supposed to be used because your body is dealing with hyperinsulinemia. And hyperinsulinemia can decrease vitamin D transport. And vitamin D deficiency then reduces osteocalcin synthesis and favors the destruction of bone cells, the destruction of osteocytes. What fixes this? Carbohydrate restriction, fasting, ketosis. Why? Ketosis increases beta oxidation. It increases antioxidant activity. It increases your bone cell viability, the osteocyte viability, and osteocalcin, and decreases excess insulin exposure. That's what you want for your bone health. Osteocalcin is required for hydroxyapatite alignment. This is the aligning of all the osteocytes along with the critical vitamins and minerals, which confers bone structural integrity, thereby decreasing bone fracture risk and improving metabolic and endocrine homeodynamics. So people presenting with fracture and normal bone mineral density should actually be investigated for hyperinsulinemia. Why did your bone fracture when you have a normal bone mineral density? Do you have hyperinsulinemia? Do you have type 2 diabetes? These are the questions that need to be answered. It's not just a matter of making sure you're taking all your vitamins and minerals. You need to not have these metabolic abnormalities called hyperinsulinemia, type 2 diabetes, cardiovascular disease, which is all the continuum of these metabolic abnormalities. And we have more metabolic abnormalities in American adults than ever. And these are the things that need to be looked at, because even in the setting of, oh, my bone mineral density is fine, you may still have a bone fracture because of the metabolic abnormalities alone, because they're not letting your critical micronutrients, your vitamins and minerals, deliver the needed metabolic sustainability in your body to keep your bone health, to keep you healthy. If you have any questions, topics of interest, you can email me. Again, it's questions@drhoffman.net, questions@drhoffman.net. And I want to thank you for joining me on another edition of Leyla Muedin. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.